Maggie. Good morning. How are you?
Hi, Sophie. I'm fine, thanks. And you?
I am good, thank you. I'm excited to talk a little bit about functional medicine and functional nutrition as we agreed to our followers. Shall we crack on?
Yeah, sure. I think it's a very important topic because a lot of people hear the words that functional medicine or functional nutrition, but they are not always quite sure what it actually means. So, what do you think? Is it just another wellness buzzword, or is it genuinely a different way to look at health or people's health?
Definitely something as a buzzword these days, I would say. But on the other hand, it's a buzzword because I think and what I see is that people actually realize that. There is something further than looking at just diagnosis and medication, which is currently happening in the healthcare system. And I usually see people in our clinic who have been struggling for even years with their health when they just don't feel right. All their tests, blood tests, and all the other tests are showing nothing out of the ordinary, but they still don't feel well. Or it's the same going for parents as well when they are certain that something is wrong with their child. They can see that something is going on, but they just can't really figure it out. So they are looking to find something which is more than just a diagnosis. They want to understand the why something is happening in the first place.
Yeah, that sounds like a great approach. But let's start with the big question. So, what is actually functional medicine? How would you describe it?
Mm. So for me, functional medicine is really looking at the whole person. So not just looking at certain parts of certain areas and certain symptoms in isolation, but it's looking at a whole person of their health, their symptoms, and what might be happening with that person. So when I say that we look at the symptoms, think about it as a tree. So we can see the leaves of the tree. So those leaves are representing all the symptoms of that person who comes to us, either a child or an adult, or couples when we talk about fertility. So they have certain symptoms. So let's say those leaves are brown on the tree. But why those leaves are brown or falling off, so why those symptoms occur, are coming from the root of the tree, which we don't see, which is underneath the surface, so within the soil. And there can be various reasons. And in our clinic, when we talk about functional medicine, we say that we actually think about the gut health, we think about the immune system, we think about the mitochondrial function, detoxification and elimination. We look at neurotransmitters, cardiovascular and lymphatic system, and the structural integrity of the body. And when we are having these conversations with our clients, we also understand their health history from the beginning, from birth. So we also understand what might have happened, what genetics predispositions might occur. And on top of all of that, we look at their current lifestyle. So everything, including their sleep, relaxation, their movement, nutrition, so the diet, any stress that they might perceive or not perceive, but it's there, and their relationships. And above, well, not above all, but to put it together centrally, the mental, emotional, and spiritual side is also there. So this gives us a whole picture of what is happening with that person or a child. So that will give us indications of why those leaves are brown or fallen off the tree, if that makes sense. So for me, that is functional medicine.
Yes, absolutely. That was, I think, a great summary. But now I think, is it less about putting someone into a box, like people do in other cases, and more about step back and look at the full picture, right?
Exactly. So once you looked at all these various parts of those tree roots or those various symptoms that I just mentioned, and then you put them into these boxes, they all together, when you connect the dots, there will be some root causes, and it's important it's causes. So it's never just one thing that tips. There is maybe one thing that tips the balance over, but there are various root causes of why those symptoms occur. So within functional medicine, we connect the dots once we identified these certain areas, these boxes, as you mentioned, and then from there we build up a plan for the person individually.
Great.
So that is functional medicine. How does this actually differ from conventional care, which I get quite a lot in clinic, and I'm sure you do as well? Can you talk a little bit more about that, Agi?
Yes, absolutely. Most of my clients contact me after being through the whole standard healthcare system. So I think it's really important to emphasize that conventional medicine is incredibly important. So don't get me wrong, we absolutely need it. We need it for the diagnosis, emergency care, acute illnesses, serious diseases. So there is a need, but there are those functional issues where functional medicine can come into the picture. So it's not about replacing standard healthcare at all. It's more like filling in a gap with the functional medicine. When someone, for example, has ongoing symptoms that are affecting their quality of life, and from a conventional point of view, the doctor says that, yeah, everything is all right, all your markers are right, but they still don't feel right. They still feel awful in their body. And they feel that something is missing, so they still don't have the full picture.
Yes, that's completely right. It's a very important thing to explain and say.
Yeah, I really think, and often the difference is that the questions we ask. So we not just ask that what do you have, but we ask why might this be happening? What is contributing to this feeling or to this disease or symptoms, and how different systems in the body influence each other. And I think that's the most important part, that we can't look at our body as like our lungs, our immune system, our gut, our hormones. They are all interconnected and they all influence each other.
Mm. If you want to understand it through a real example, health example through your clinical experience, can you give me one or a couple what you have experienced with clients?
Yes, of course. So in the clinic, my main focus is digestive health and women's hormonal health, perimenopause and menopause. So a very common example would be somebody is coming with digestive symptoms like bloating, abdominal discomfort, constipation, diarrhea, food reactions, maybe fatigue as well. And they might have been told that, yeah, everything looks normal, but they still feel really unwell. And then the questions we ask are kind of, could a gut dysbiosis be part of this picture? Or could SIBO involved? Or how well is the digestion working? Or it's a big question and very important, is stress affecting gut function? And the answer is usually yes. Or is the sleep poor? And is the poor sleep that contributes to the symptoms, or the symptoms influence the poor sleep? It works both ways. And is the person eating in a way that is actually supporting his or her body, or is the diet perhaps making things even worse? So these
Mm.
are the main questions we try to ask, and not just to deal with the symptoms they are presenting with.
Very interesting.
And yeah, if I want to mention another area, that would be perimenopause or hormonal symptoms. Sometimes somebody might come with low energy, poor sleep, mood swings, bloating, cravings, weight changes, constipation, loose stools, or you can continue. And these things are often all linked together. So rather than looking at each symptom separately and seeing different doctors to treat that symptom, we ask how gut health, stress, inflammation, blood sugar balance, and hormones may be all interacting and presenting in these symptoms.
Mm. Yeah, if you think about the trees, and it is just showing that as everything is
Yeah,
all
absolutely.
connected.
That's
Yeah.
the basis of our work. And how does it look like in your work, Sophie?
Yeah, so I mainly deal with children and couples struggling with fertility or pregnant moms expecting mothers. And also I deal with hormonal issues as well as you do. But everything is corely starting with digestive health, I would say, because that's where the center is of all the other functions mainly. So when mom comes to me with a child who is not sleeping, where you also mentioned sleep, but also there are behavioral issues at school or in kindergarten, or they are not growing, or they have recurrent ear infections or throat infections, or just literally being sick all the winter time. Their weight they might not gain any weight, but there might be speech issues or learning issues for these children. So we then, again, as I mentioned, look at all these root causes and understand in which areas of the symptoms with which box, sorry, of those symptoms fit in to see which area we need to support more for the body to be able to support itself, for the cells to be able to support themselves. It's the same with fertility, so it's gut and hormonal related mainly, which I see for people, both for men and for women. But it can come up with it looks like as if it's an immune issue, for example, the woman being always sick or having even recurrent urinary tract infections, which again is connected to the gut and hormonal, well, sorry, gut health itself, the microbiome and the vaginal microbiome. So there is quite a lot of symptoms, but as we said, within the tree, we look at the root causes and connecting the dots, helping us putting it all together. Um, it really is a common thread, isn't it, that everything is going back to the gut in the end? What do you think, Agi?
Yes, absolutely. Because symptoms in one area of the body often have roots somewhere else. Like you mentioned, fertility. We first think that, yeah, look at the hormonal health, but then we discover it's influenced by gut health or immune issues, and they might influence the fertility as well. So other things need attention too in these cases as well. And that's another main area of our approach, I think.
Yeah.
There is another buzzword we hear very often. It's a whole person approach. It has become very popular, I think. So, what are we actually looking at in practice when we talk about whole person approach?
So as I mentioned through the tree, is we are trying to understand that person who comes to us, that client's symptoms, the whole story, not just the symptoms, sorry, but the whole story of it. So I mentioned the diet, the lifestyle, the sleep, the stress. So it's not just of what's happening now. We also look at how they were born, for example, whether they were born naturally or through cesarean. Were they sick a lot when they were children? Did they move a lot? Did they move countries? Was there any digestive upset while moving, while even visiting countries? Did they take loads of antibiotics? So we are looking at and gathering all this information because we are looking at the whole person. And I mentioned genetic predisposition as well, so we can also test. It's called nutrigenomics, this area of science where we look at the genes itself of how by the lifestyle and diet we can influence them. So when we look at someone's story, we are looking at this whole person itself from literally from when they were born, even before until now, with everything all together. So in my world, it's not even a buzzword, it's something that I wish all my doctors would have done when I was sick, when I was younger, and probably I would not have ended up being so sick as I got in the end. That made me choose to get into functional medicine in the end.
Yeah, absolutely. And I think it's also important to mention that in our approach, it's not just about giving supplements to people, right? So
Yes, that is
many
certainly.
people think that doctors give medications. So maybe functional nutrition is about food and supplements. But now we see that it's a much bigger approach, a bigger picture. So how do you think about supplements? Is it part of the solution in our case?
It's a sometimes yes, sometimes no. So here comes the individualization, so the personal approach itself. So I can give you an example of there are certain autistic children whose food palette is very limited. So in those instances, we do need to apply and rely on a little bit more supplementation that I would normally do because we need to ensure that they still have what their body needs to function. But there are um, have certain problems where just simply focusing on the diet itself and adding in more dark leafy vegetables or even drinking enough water or moving our body regularly is giving so much positive of a change for that person. So supplementation is part of it or can be sometimes part of it. It really depends on the symptom, the problem, what we want to achieve, and I wouldn't even say how quickly, because we cannot derive our body how quickly we get to, or ourselves how quickly we get to the state where we want to get to. It's literally of like a game of realistic changes, which we do step by step, where we drive our clients and work together with our clients with what they can achieve and how we are going to achieve, focusing mainly on diet and lifestyle changes and a little bit of supplements as well. Yes, if that makes sense.
Yeah, yeah, absolutely, I think.
Okay, so once you have that bigger picture,
Mhm.
right? How does support really looks like in your clinic, Agnes?
So I would say it's a much more personalized than people expect. Obviously, people come to us because they didn't feel better by the conventional way. So it's not a one size fits all plan. As you explained before, we look at those areas and it already gives us the picture how to support that person and not the one before we had a consultation with and not the next one we gonna have a consultation with. So the approach involves changes obviously to diet, to the meal structure, meal timings, for example. Uh, we always work with gut support to some extent. We look at stress management, sleep support, and then obviously, as you mentioned, targeted supplements where needed. But the first approach is food. So food is always first. There are cases, as you mentioned, where it's kind of limited. It's not just maybe a child, as you mentioned, but also somebody with a digestive issue who has a very limited diet. So their targeted supplements can play a bigger role. And I also have to mention that we often work alongside other healthcare professionals, maybe doctors, maybe other complementary therapists, whoever we need to give the best support to our clients.
Yes, definitely. And I think it's also important to say that our clients are really involved in the process of this step-by-step personalized approach, isn't it?
Yeah, absolutely. They need to. So otherwise, uh, we don't believe that you are just being told what to do and you get better. You must be part of the process, part of the decision making. Even at the consultation, when it comes to diet, we discuss your lifestyle. Can you cook at home? You ordering your food? Do you have to take your meals to your workplace? Can you heat it up there? Or you need something that can be eaten cold as well? Or there are many cases. And the other thing is that ideally our patients understand how their body works. And I think it's really, really empowering for our clients once they understand why they have the symptoms and why the symptoms can change. So what they can do to initiate these changes. So we are there to support them in this process.
Exactly. Yeah.
And yeah, when we talk about clients, who do you think this approach tends to help most? So which type of clients do you
Mm,
think can
I
get
would
the
say,
most? Sorry.
oh, sorry. I would say any type of client. So recently, I even had some conversations with mothers of how should I start removing ultra processed food from our diet because I realize we eat too much of that as a family. So even as a preventative support is there to help, which is great for families, for children, for couples who are thinking of getting pregnant at one point, um, even without trying now, just to prepare their bodies, but also obviously children and adults who have ongoing symptoms which are actually affecting their everyday life. It's essential, as you say, to find out the whys, for them to understand the whys, and also understanding the steps they can take to feel better and improve their health and optimize their health. So anyone with digestive issues, fatigue, immune-related issues, or hormone-related issues, anyone with skin issues, poor sleep, inflammation, but as I mentioned, also with sorry, sorry, also with behavioral or developmental issues, autism, PANS, PANDAS. So these are now what I mentioned is mainly children, but as I said, those couples struggling with fertility or anyone with any hormone-related symptoms, or you wouldn't even know that it's actually anything relating to a gut issue, but actually, when we talk about it and we dig deeper, we realize where the root is coming from. So it's always great to have these conversations. And as you mentioned, Agi, you are dealing with women, mainly women's health, digestive health for men and women, and perimenopause, menopause. So I'm guessing it's also a great tool for them too.
Yeah, absolutely. And then what is also important to mention that it can be a preventive approach. So not just waiting until things get worse, like that what my work is around in perimenopause. So not just wait until the menopausal symptoms kick in very hard, but trying to prepare for that period of life and trying to understand earlier what might be contributing to the problem and try to avoid them or just limit them as much as possible.
Mm, definitely, definitely. So if we need to sum it up in a very simple way, what would you call functional medicine is really about?
Yeah, so I guess we talked a lot about how we approach health in this way, but for me it's about understanding the why. So the question why behind the symptoms, looking at the body as a connected system, as a connection of organs,
Mm,
and as a result, create a personalized plan that supports better health in kind of a realistic and sustainable way. So it's not like in most cases, it's not a short-term solution, but more like a longer-term help or support for our clients.
exactly, which can be a building block for the future as well for the mezzanine.
Absolutely.
Yeah. And then obviously, as we discussed, the whole person itself. So it's not just looking at the symptoms and the labels and the diagnosis of this and that, but actually look at the person, understand what they are struggling with, and understand which are the things that are helping most, for example, with your first steps of those personalized plan, and work on that and have the person step by step to get better to reach optimal health in the end, isn't it?
Yeah, exactly. And I think that's why this approach is such an important part of what we do at Generation Super Health Clinic and how we try to support our clients.
Exactly, exactly. Thank you very much, Agi, for the
Thank you very much, Jofi.
conversation.
Have a good day.
And you.